and welcome to the latest edition of the Endometriosis Diary. Update. I ended up going to the emergency room last night, and if any of you watching have endo or have any chronic illness, then you know going to the emergency room is always hit or miss. If you deal with chronic pain, you usually can kind of play off your pain pretty well, so people don't actually know you're in as much pain as you are in. And then that proves to be a problem anytime your pain does get to the point where you need medical intervention, like I did yesterday. It's like the doctors don't believe you because you are so used to being in pain. So you're not screaming when you're at a 9 or a 10, you're just laying there quietly crying. So that's always a struggle that I have. Every time my pain gets to that level, which is fairly often, I have to make like a pros and cons of, do I want to go to the ER where I know I might get pain medication that will help? Or do I not go because I know they're going to treat me like I'm just there for the drugs? And I think it's terrible that it comes down to that even has to be a thought. I understand people abuse the system. People are, druggies and junkies, and they do go to the emergency room just to get, morphine or Dilaudid or, a prescription of a narcotic or something like that. I do know that happens. I'm not completely naive. I understand. But at the same time, I feel like the amount of people who are in the emergency room for legitimate pain, like, it's a lot. It's the majority of people, and the minority is, the people, the junkies. But we're all treated like we're just drug seekers. I'm not addicted to pain medication. Not at all. I've never become addicted to any pain medication or anything like that. And I've been on Percocet, Vicodin, Tramadol. I've been on all of it, and I've never been addicted. And I have even been on it for, a month at a time, and I still wasn't addicted. So when I go in and the doctors are like, oh, well, we don't want to give you Norco because, it's got very addictive properties, and, a lot of people end up getting addicted to it. I understand that. I recognize that. I appreciate that. Thank you for telling me. But also, that's something that I already know. I'm already aware of. I have seen people become addicted to pain medications, but I'm not addicted to pain medication. I am addicted to being pain-free, or having my pain be as low as I can get it, which is usually like a 3 or a 4. That's like the best my pain ever gets. So no, I'm not addicted to pain medication. Am I going to ask for it? If it gets to that point, yes, I will. Because I don't want to be in pain. And I don't understand how that is such a hard concept for people to understand. People who are in chronic pain, they're not trying to get high. They're not trying to get, trying to get these medications for fun. They're getting them because they are the only thing that helps when their pain gets to the point where they just don't want to exist. And, my pain is pretty terrible right now. I'm currently on Vicodin. I'm not ashamed of that. Not at all. If it helps, I'm going to take it. Like, I'm not going to have someone tell me to not take a pain medication because, it might mess with my head or, whatever. Like, if there was, I don't know, I feel like if there was, like if I knew, if it was like Depo-Lupron then I would definitely, you know, not take it, because Depo-Lupron, like, I have been on Depo-Lupron, so I know the side effects from that, but I know the side effects that I get from Vicodin, and I know the side effects that I get from Vicodin I can handle for the amount of pain reduction it gives me. And, you know, it doesn't reduce my pain a whole lot, but it definitely takes like the burning and the stabbing sensation kind of down. So it kind of dulls it out, which makes it a lot more manageable, makes it a lot easier to deal with. And when you've been in pain every day for 3 years, you just want to be able to get through the day. So today I am still in a lot of pain, not as much pain as I was in yesterday, thank God. Yesterday I was crying and I was curled up in a ball. I like couldn't move. It was honestly the worst pain I've ever been in, which is saying a lot. But today I'm feeling a little bit better. I'm still in a lot of pain. You know, they did the typical ultrasound, pelvic exam, and they found, this is Bear. He is my Saint Bernard. You want to say hi? Good boy. He takes care of me. But they did find I have an ovarian cyst, which is exactly what I thought. I thought it was either a new cyst or one rupturing. So I'm kind of glad that I can tell what's going on in my body, to the point where I knew it was a cyst. Well, I thought it was. But anyway, that is today's pain endometriosis diary update thing. Wishing you all a pain-free and happy day, and I'll see you next time. Bye.